Small intestinal bacterial overgrowth is a condition which frequently is misdiagnosed as irritable bowel syndrome, as patients present themselves to the doctors with bloating, sometimes with or without diarrhea or constipation. So SIBO is a condition where healthy colonic flora, which every healthy human being contains, leaves the area where it's supposed to reside, the large intestine, and ascends through the ileocecal valve into the small intestine. Causes of feeling of bloating, gaseousness, can cause diarrhea because of those special chemicals, can be a source of abdominal pain, and many of the patients that have been previously diagnosed with irritable bowel syndrome, simply because they were never tested for this particular condition, or because they never knew that they needed to get tested, basically start taking medications such as antispasmodics with minimal to no effect, when in fact they didn't have any such things, and they have quite a diagnosable and quite treatable condition. In my practice, we employ a hydrogen lactulose breath test, which is a simple test where patients will come in on an empty stomach. They will drink a 10 to 20 gram solution of lactulose. Lactulose, by the way, is a non-absorbable sugar that is perfectly safe even for diabetics. And then once they do that, every 30 minutes thereafter, they start breathing into a microcomputer which detects the levels of hydrogen. Special microcomputer that is designed to detect even minute amounts of hydrogen in our breath is exactly what's employed to detect within the first 2 hours of ingestion of that particular lactulose solution. Once we see that the patient's amount of hydrogen during their exhalation exceeds 15 to 25 parts per million of hydrogen, that test is strongly diagnostic for the small intestinal bacterial overgrowth, and a simple 2 weeks course of non-absorbable antibiotic will cure them. In my practice, we had diagnosed hundreds upon hundreds of patients who in fact have been misdiagnosed with irritable bowel syndrome, when in fact they have a perfectly diagnosable condition and a perfectly treatable one at that.